So hello everyone, my name is Ali Tavakoli. I'm a minimally invasive and bariatric surgeon at the Brigham Women's Hospital in Boston. And I want to thank everyone for this opportunity to briefly talk about this topic of assessment of the trainees via an oral exam. As you know, there are multiple ways that we can assess a trainee's level of knowledge. The most common technique that's used is the multiple choice question, which is really focused on getting to the factual knowledge of the student or the trainee. Sometimes we can test this factual knowledge in a more elaborate way using written essays. And when it comes to clinical assessment of certain skills, we rely on OSCEs, or Objective Structured Clinical Examinations. What we're going to talk about today, however, is oral exams, which is, as probably many of you feel, is the most dreaded form of knowledge assessment. The reason that oral exams are still used today is because it allows us to assess a candidate's factual knowledge, but also their level of understanding of the topic. So the assessment really goes beyond memorization and really focuses on understanding of a topic. The format of an oral exam is often a one-to-one interaction between an examiner and a student. It's a dynamic situation where the examiner adjusts the question based on the student's answers and demonstration of knowledge. And it's really designed to test the limits of the knowledge of the student. As well as assessing information that they know and their understanding of the topic, oral exams also allows for assessment of presentation skills. And in a field like medicine, important is ability to communicate, respond on the spot, and also quick evaluation of data to demonstrate critical thinking. There's been some debate whether an oral exam actually achieves these goals, and there have been several studies on this. I'm just going to highlight a project that was done in the Department of Surgery at the Brigham. And what they did is that they looked at 629 surgical clerkship oral examinations that were performed, and they reviewed the examiner's comments section. So as well as giving a grade, the examiners are provided an opportunity to provide comments on the student's performance. So they examined these comments and they divided the comments into several categories, specifically comments related to clinical knowledge, comments related to cognitive process, comments related to professional and interpersonal interaction. And what was interesting was that they found that these oral exams provided a rich opportunity for evaluations of important topics, many of which were not actually assessed by other tools of examinations that the medical students currently undergo. And specifically, comments on communication, decisiveness, and critical thinking were not assessed by other forms of exam. So although the oral exam remains an excellent form of assessment that provides unique insights into a trainee's level of knowledge, it is challenging to organize and perform. And many students and trainees are aware of the level of stress that they're under when they do an exam, but it's important to know that the examinee is also under stress to some degree because they have to think about good questions, they have to dynamically change the scenarios to help assess the kind of level of knowledge an resident or trainee has. It is time-consuming and challenging to coordinate, to have both people at the same place at the right time. It needs planning to develop appropriate questions to make sure that the scoring criteria are similar across the board between different examiners. And there's also the challenge of likability bias, which is what happens when people walk into the room and the examiner, based on what they may say or how they may behave, may decide that they like or do not like that person, and that subsequently influences how they assess the trainee. Despite its challenges and its the concerns that the students often have about oral exams, there are some benefits to them by doing an oral exam. For candidates who are good, it really demonstrates their mastery of the topic and helps them differentiate it from others. So, for example, this can be important for a medical student who is interested in surgery. This allows them to really show that they don't only have some factual knowledge about the topic, but they have a deep understanding of the issues, and they show critical thinking and assessment of data on the spot. It also allows opportunity for students to ask for clarifications and clear up misunderstandings, which otherwise in a written exam you don't have. And also, you have to remember that the examiners want people to do well. So if they feel that the students are going off a tangent and not answering the right question, they often provide prompts and help guide the student. The benefits to the examiners, which I think to some degree we've talked before, it allows ability to assess students' knowledge and understanding, but also their ability to communicate this to others, and this could be colleagues, patients, or other care providers. This aspect is probably more important in some fields. So there's been some debate that oral exams in fields such as engineering are obviously less frequently seen, but in something like medicine and certainly some specific specialties, it is a more important aspect. Some tips for a successful oral exam. So I think an important aspect of an oral assessment is the ability for the candidate to think on their feet. Now, some people are good at this, which is great, but if you're a candidate who's not good at this, it's important to prepare, to think about all scenarios that can be presented to you and prep for them before. When you turn up to the exam, look and act professional, arrive on time, and remember that the exam starts the moment you walk into the room. So that early impression that the examiner may have, and what we referred to earlier as the likability bias, you want to make sure that you turn that to your advantage. During the questions, listen and stay focused and answer the questions that were asked. Don't drift off on unrelated topics. If you don't know something, do not ramble and waste time. Time, it can be your enemy. So if they're asking you a question that you don't know much about, try to acknowledge that you don't know what you would have done otherwise, and try to move on to a topic that you know something about and you can show your level of knowledge on. Remember, each new question is a new start. So if you have not done well on a question, don't let that fluster you. Relax, take a deep breath, and take the new question that comes in as an opportunity for a new start, and always remain confident during your presentation. Best of luck.